Eclampsia. Prepared by Mr. Artembo. Eclampsia is an acute and life-threatening complication of pregnancy, characterized by the appearance of tonic-clonic seizures, in a patient who had developed preeclampsia. Pathophysiology. Eclampsia occurs only in the presence of a placenta and is resolved by its removal. That placental hypoperfusion is a key feature of the process. It is accompanied by increased sensitivity of the maternal vasculature to pressure agents, leading to vasospasm and hypoperfusion of multiple organs. Further, activation of the coagulation cascade leads to the microthrombi formation and aggravates the perfusion problem. Loss of plasma from the vascular tree with the resulting edema additionally compromises the situation. These events lead to signs and symptoms of toxemia, including hypertension, renal, pulmonary, and hepatic dysfunction. In eclampsia specifically, cerebral dysfunction occurs. Preclinical markers of the disease process are signs of increased platelet and endothelial activation. The stages of an eclamptic fit. In about 50% of patients, the eclamptic fits precede the onset of labor. In the antenatal period, 25% occur during labor, and 25% in the initial postpartum period. The convulsions itself is much like an epileptic fit, with similar stages. Convulsions are usually preceded by an increase in the severity of the preeclampsia and by the advent of the serious secondary features. The premonitory stage lasts 10 to 20 seconds, the mother is restless and rapid eye movements can be noted. The head may be drawn to one side and twitching of the facial muscles may occur. The mother has no perception of the impending fit and shows altered awareness. The tonic stage lasts 10 to 20 seconds, the muscles will go into spasm and become rigid and her back may become arched. Her teeth will become tightly clenched and her eyes stare. As the diaphragm is in spasm, the mother's respiration is reduced and will be cyanosis. The clonic stage lasts 60 to 90 seconds, violent contraction and intermittent relaxation of muscles producing convulsive movements and may be very severe. Salivation increases and foaming at the mouth occurs. This will be bloodstained if the biting of her tongue during this episode occurs. The mother's face becomes congested and bloated and the features become distorted. She is unconscious, breathing stertorous and her pulse full and bounding. Gradually the convulsion subsides. Stage of coma, stertorous breathing continues and coma may persist for minutes or hours. Further convulsions may occur before she regains consciousness. During the fit the fetus has bradycardia. Effects of eclampsia on mother and fetus. To the mother, cardiorespiratory failure, cerebral hemorrhage, hepatic failure, hemorrhage. To the fetus, anoxia, bradycardia, fetal distress, fetal death. Differential diagnosis. Seizures during pregnancy that are unrelated to preeclampsia need to be distinguished from eclampsia. Such disorders include seizure disorders as well as brain tumors, aneurysms of the brain, and medication or drug-related seizures.